Welcome to the Southwest Missouri Business Podcast, the only podcast in the Joplin area focused on building profits and community for local people like you. Join us for awesome interviews with local business leaders. We learn new stuff about business and have tons of fun. You're listening to the Southwest Missouri Business Podcast with your friend, host, and owner of local commercial cleaning business, Service Master of Southwest Missouri, Emily Tuschik.
Hi, everyone. Welcome to the Southwest Missouri Business Podcast. I'm Emily Tuschik, and I'm really happy to have Dr. Joseph Sheppard with me today. He founded here in Joplin and Neosho the free market physician practice, and so I really love what he and that business is all about. And I think we're going to have a really good conversation today. So if you haven't been there before, if you don't know, the free market physician is a little bit of a different medical practice. It's direct primary care. Is that right? Is that what you call it? Awesome. Yeah. And so I really love the idea behind it that you know your doctors, you have direct access to them, and you're not stumbling through the medical system like how people typically are. Am I kind of representing that correctly? Is that?
Yeah, that's very fair. Yeah, it's the relationship with the patient. So the patient has direct access to their physician. And then the other part of it is the payment. You cut out the middleman. And so it's the payment directly to the clinic, bypassing the entire insurance system.
Very cool. Yeah, I know that just being a patient myself, being a person dealing with day-to-day medical issues, that is one of the biggest hurdles. That's so tough. Just thinking, when I have a minor medical issue, just that kind of deters me from even kind of seeking treatment for it. That can be tough. I haven't even been in to see you guys yet, but that I know that's such a draw just to know that I wouldn't have to deal with that.
Yeah, and it's a comfort to the physicians as well, knowing that so often in a physician's practice, you just don't have time to take care of patients. You're sending them off to urgent cares and ERs, and good doctors want to take care of their patients, and this
Exactly.
sort of model allows us to treat our patients the way that we want to.
That's amazing. Yeah, and I imagine you see a lot better results from that. A lot healthier patients and happier patients, probably.
Yes.
Yeah, that's amazing. Well, I mean, it sounds like such an amazing model. When I first heard about it, I was like, well, duh, that's kind of what medicine should be. I'm kind of wondering, why. I can imagine there's a lot of barriers, but why aren't more physicians doing this? And how, was it really, really difficult to get this off the ground, get this started?
Yeah, that's a good question. The reason more physicians don't do it is because I think the model just isn't out there for them unless they want to be an entrepreneur and take risks and jump in and self-fund and all these things. The jobs are out there in the insurance world. And so you graduate medical school with hundreds of thousands of dollars in debt, and you don't exactly say, hey, I'm gonna do a startup business. That's not the time for that.
Yeah.
So I think that's the why. And it is hard to start. There are a bunch of clinics like mine popping up all over the country.
Okay.
But right now, most of them are by self-starters, people that are willing to take the risk to finance themselves or get a loan and not be paid for a year or two as you're trying to build up your clinic. Work side gigs to support yourself and your family and try to pay off debt. And so the barrier for entry is, it's there. And so in our case, I knew what I wanted to do, and this was kind of what I wanted to do from the beginning. And two, it was a risk I was willing to take because I was confident that the message would resonate with people here, that if we built a clinic like this, that people would be appreciative of it and come to it. And that's been our experience.
Very cool. So I hadn't realized that there's kind of a growing market and more clinics like this popping up. That's amazing, because like I said, it just makes sense that this is kind of how I guess it's more how medicine used to be, but kind of what people are returning to because people want this. It seems.
Right. Yeah, and there probably, I would guess there's probably somewhere around a couple thousand of these in the country right now.
That's
And
awesome.
there's always new ones that are coming in. There's always ones that, physicians are not always the greatest businessmen, and so there's always those that are on their way out as well. So,
That's
but yeah,
unfortunate.
it is a
Yeah.
growing movement.
Yeah. Is there much support or networking between you physicians who are doing this, who are kind of like minded, and do you guys reach
Yes.
out to each other and share knowledge, share lessons learned?
Yeah, there's extensive networking and support.
Very cool.
We're fortunate. A lot of the kind of the early movers in this kind of just established a culture that we're all helping each other.
Yeah.
There's not a lot that's proprietary. If someone comes to you and says, "Hey, I want to start one of these," and you do everything you can to help them get on their feet and get going. And that was my experience when I was getting started, and that's what I've tried to do for others as they come to me.
Very cool. Yeah, I think that's so important to you go out and do something and you learn, you make some mistakes, maybe you learn from those and kind of pass that along to other people and share what
Yeah.
you know because it kind of jump starts them a little farther
Yeah.
ahead. That's awesome. Um, Actually, kind of on that topic, do you have any advice for someone who might be 5-10 years, I guess behind where you are now, who kind of has the same type of idea and mindset, and they want to kind of go down the same road to be entrepreneurial in the healthcare field?
Yeah,
What can they be doing?
that's a good question. Yeah, I think physicians a lot of times feel burdened by their debts, and they feel like they're in a tight spot. But the truth of it is with all the training and everything we get, we have a very valuable service that we have to offer. And so
Yeah.
I think we can take the risk and offer it in a more idealistic way, and usually it's going to turn out. What we have is somewhat scarce, which is really good medical care. And yeah, it's scary and it's hard, but you can do it, and you can especially do it with the support of other people around you, with other physicians that have done it. It can be done. Get good advice. It can happen. You have something of great value, and you can sell it differently than the insurance system is selling it.
Mm-hmm. That's huge. The point you made about the support and like not doing it alone.
Yeah.
Finding people to support you and building that community.
Yeah.
I think that's huge. That's a big thing. And focusing, I guess, a little more on the patients. I know there's a lot of medical anxiety out there, for different reasons. Maybe they had a bad experience in the past. Maybe just like a busy entrepreneur like us, working all the time, just saying, "Oh, I'll deal with it later." It can be hard to just get in to see a physician. Do you have any tips for people dealing with that? Reducing the barriers a little bit to get people into see a physician more frequently when they do have an issue that comes up.
Yeah, I love the term family doctor because it kind of brings in this feeling of intimacy and familiarity and of having a friend, and you start thinking of doctors carrying around bags and showing up at your house. And I think that's what doctors really want. That's why we went to medical school. It wasn't so we'd see 8 patients an hour and snap at them when they ask us a question.
Oh my gosh, yeah.
It's because that's what we want. And so, a model like this where, in a way, all of my patients have all my time. And well, I think I'm getting a little off track on your question, but as a patient, to have a physician that knows you by first name, is going to recognize you in Walmart, knows the name of your kids and your dog, they know what you do for work, that you can text after hours and say, "Hey, this just happened to me. Do I need to worry about it right now, or can I call you tomorrow?" Physician where you're having a rough day, then you can get a same day appointment. And it's not a rush, like a 10-minute or even a 30-minute appointment with your physician and solve it right now. A physician, if you've got a kid, you don't have to wait 3 days before they see the doctor. All these things just bring so much comfort to have that relationship and then to have the access. And so that's what this model offers is the time to get to know people and to take care of them well. and then the access between the physician and the patient, where the patient really can just reach out and ask a question, as easy as that.
Yeah.
My patients
Awesome.
text me all day, every day, and I just respond to them, and that's what they're paying for,
Mm-hmm.
and that's what they deserve. Our health is, our most valuable investment. It's what's going to determine the quality and duration of our lives, and so we deserve and we need a better system to care for it than the standard system that we have now.
Yeah, we really do. I think most people, myself included, sometimes we really neglect our health, just kind of thinking it'll always be there. It's gonna, maybe it's good now, it's always gonna stay good, and you have to treat it like an investment. You have to do little things every day, or every so often to just as if it was a bank account, as if it were an investment, to keep it in good shape.
Certainly.
Yeah. And having that type of family doctor relationship is something that we, with how the medical system is now, we just kind of disregard. But that can be a part of that investment. I think that would really help kind of bring that back to the forefront.
Yeah, you're absolutely right. And so being able to go into an office and feel like the doctor on the other side of the room has that same goal of taking care of you, and doesn't feel annoyed that you're in or inconvenienced that you've come in, but is your partner in preserving your health. Like that's what we're trying to do in this sort of system, is become your partner in that.
That's huge. Yeah. I know one thing you offer is just kind of from being a business owner like myself, from that perspective, you offer business plans for small, medium businesses. Can you tell us a little more about that? Because I know we'll have some listeners who are also business owners. I think that could really appeal to them. How does that work if someone wanted to offer more benefits to their employees? That's something I'm thinking about. And I think anyone who has employees, trying to retain them, trying to help them develop and grow, and be aware of their families and help their families the best they can. I think that's a really great thing to offer them. So how does that work with what you offer?
So first off, you mentioned small and medium businesses. We don't discriminate against big businesses.
Sure.
If you can bring us 1 million patients, we'll take
Awesome.
it. It's fine.
Yeah.
But the small businesses are in a little bit of a crunch because they want to take care of their employees. They want to do right by them, and then you want to retain your employees. You want to be able to track quality people, and the tool that's used to do that right now a lot of times is health insurance, which is this ghastly expensive, horribly inefficient tool that immediately hobbles the medical care that they're going to get in the first place. But that's what people want. And so, what our service is that we're a membership clinic, so people aren't paying for individual visits; they're paying a membership fee to have access to us whenever they need us, and then for us to manage their chronic care. And so, you could offer that as an employer to your employees. It's I will cover your membership fees at Free Market Physicians so that you always have access to primary care. Or I'll cover a portion of your membership fees at Free Market Physician Clinic so you always have access to primary care.
Very
And
cool.
so I think we've got 40 plus small businesses that are signed up with us now. And a lot of them are kind of mom and pop shops with just a couple employees. And then some of them are quite a bit bigger. But they will offer that either as a standalone benefit. A lot of them, the numbers just aren't there to offer group health. And so they'll offer just us, and their employees appreciate it. And when they get sick, we get them in right away. And, we become an important part of their lives, a lot more important than that, Blue Cross Blue Shield card that just sits in the wallet. And you have to pay $10,000 before you see anyone anyway.
Yeah. Oh my gosh.
And there are other groups that will combine us with some sort of group health. They say, all right, we want our people to have some sort of insurance in place in case they need to go to the hospital. And so their employees go out and buy those plans, or the business provides them, and then we provide the primary care side.
Okay. Very cool. Yeah, coming from where I used to work, it was a large company that had just that high deductible plan, and it was good to have when you needed something big, but day to day, just a doctor visit, that was still a very high bill. So
Yeah, and the thing about health insurance, health insurance is not the same as access to health care. It's just a funding mechanism. And
right.
so if the only thing you're funding is a high dollar surgery or a hospital trip, there still is no access to primary care. They're
Yeah.
still going to have to go, figure that out, pay whatever has to be paid. And so there has to be a sanely priced medical system in place to accommodate that. And that's what we're working to be.
Exactly. Yeah. There's so many people that are just kind of left out of access to day-to-day medical care and treatment, and that's like we were talking about with the investment in your health, that their investment level just is dwindling and is so low.
Yeah.
It's a shame. I guess that kind of makes me wonder what is your long-term vision for free market physician and for the health, everyday people's health in Joplin and Neosho and the area around.
Yeah. Well, thank you for asking. So, you know, the, for anyone that's got the guts, any doctor that has the guts, you can open up a clinic like this.
Yeah.
And it kind of takes that kind of unicorn of someone that is willing, that has the degree, is willing to take the risk, and has enough self-confidence, whether they should or not, that they think that they can run their own business after going through medical school. And oh man, I've had to learn so many things the hard way, and luckily I'm still in business despite that. But that combination of person with the training and the risk taker, and who at least thinks they have the business acumen to do it, is rare in the medical world. And so I think we have to create a system where this thing actually becomes scalable, where I am not just asking, where I'm not talking to my friend say, oh, you could do this yourself, just take out a $200,000 loan and start, but where I can say to my friend, hey, I can salary you and bring you into this, and we build it in a way that it funds itself. And so for me, that's the goal. And us as a clinic, we're pushing all our chips to the center on this, on saying, we think that we can really grow this. We think that we can really scale this. And so it's a matter of financially preparing to do that, and of having the confidence that you can bring in the right physicians, the right doctors. You need the people with the skills and the ideals that they actually do want in those patient interactions. And I think most people leave medical school with that, and it kind of gets beat out of you, through residency and then through years of the insurance system. We need to find the people that are really ready to engage with people on that. And so that's our vision, is to scale this so that we can have more beneficiaries among our patients, that we can really have world-class primary care with physicians that know you and care for you and make time for you, and make this a system where physicians and nurses can preserve their careers. The burnout is just devastating in the industry. The shortages, part of the reason they're so high is lack of medical school and residencies, but a lot of it's because this system just takes idealistic people who are trying to make a difference, and it just chews them up and spits them out.
Yeah, it's terrible.
And those that stay, there are a lot of them that remain happy and great servants of the people, but it gets really hard. You're in the system where you're pressured to see so many people to make your salary, or there's just so much of a shortage that you really have to fly through people to take care of them. And that's a recipe for disaster. That's a recipe for suicide, for addiction, for shortened careers. But if we deliver this right, if we do it right, it's such an uplifting process. It's something that you say, yeah, I would love to dedicate my life to this, and feel like I have purpose, and feel like I have meaning, and feel like I have balance, and that I'm making the world a better place. And that's what we want for physicians and nurses, not angry, bitter people at the end of their career saying the heck with it.
Oh my gosh. Yeah. That's beautiful. Thank you for sharing that with me. Like that, and when you, as a patient, when you go into a medical facility, an appointment, anything, that's what you want to be met with. And that's a beautiful vision, and I believe in it. I know you're gonna help the area attain that. I love that. I think it's gonna be great.
I hope so. Either that, or we'll go bankrupt. One of them.
Yeah, I think we're all as business owners, small business owners, I think that's kind of all the line we're all walking. But yeah, I think we're a community. We're in it together. So we're talking about the support. That's what we're here for.
Yeah.
Awesome. Well, is there anything you want to talk about? Anything I should have asked you that I didn't? That you wanna get the message out?
No, I don't think so. You know, I can speak. You know, if anybody's on the fence about coming on board, I can speak very highly of everybody that we've got involved here. You know, we got Dr. Matos down here in Neosho, who is just passionate about good medical care. He is a scholar of it. He's an enthusiast of it, and he will do everything in his power to diagnose and treat and take care of people. And he's wonderful. And then we have Dr. Hansen up there in Joplin, who is just wonderful. Who's kind and compassionate. Comes out of residency with all the latest and greatest. I think if I were in the Joplin area, wondering who I should establish care with, who's the best doctor in town, I would put Dr. Hansen at the top of that list. So if you're on the fence, we would love to have you.
Awesome. I think anyone in the Joplin, Neosho area would be very, very well served by coming over to Free Market Physician. So really appreciate you spending the time with me today. My last blurb is we are sponsored by Service Master of Southwest Missouri. So any commercial cleaning needs, give them a call and we'll give you a free towel and grout cleaning in your bathroom. So that's it for us today for the Southwest Missouri Business Podcast. Thanks, Dr. Sheppard, so much for coming on.
Well, thanks for having me. I appreciate it. Likewise.
All right, everyone, you did it. You spent a few minutes learning, having a little fun, and supporting the Southwest Missouri business community. If you haven't already, tap the subscribe button so you don't miss any new episodes. And if you got something out of this episode, I'd love it if you could rate, review, share on YouTube or Instagram, text your friends, tell the whole world.